tonight's webinar. Also, tonight's webinar will be recorded, so if you'd like to view the recording following tonight's event, it will be posted on our YouTube channel, which I will have a link to later on in tonight's presentation. I also wanted to touch quickly on certificates. Certificates will be sent out for tonight's webinar, and they will be automatically sent out within the next 2 weeks. They will be sent out to those who participate in tonight's live webinar and are active for more than 45 minutes. At this time, I would like to hand everything over to JoEllen, who will be tonight's presenter. JoEllen?
Thanks, Sarah. My name is JoEllen Wolicki, and I am a nurse at the Centers for Disease Control and Prevention in the Immunization Services Division, and I want to thank Sarah for inviting us and giving me this opportunity to talk to you all about vaccines. Today, we're going to focus on vaccines that protect young children. Sarah, I got a problem. I got a thing up that says nobody sees my screen.
You'll just need to accept that you are the presenter, and it should show your screen.
Okay, I'm sorry. So show my screen. Do you see it now?
Yep, everything looks great.
Okay, I'm sorry for that. I'm a nurse. I'm not I'm technologically challenged. So anyway, today we would like to talk about the vaccines that protect infants and young children from vaccine-preventable diseases. Vaccines are something that are not done when you're a child. They're something that you do throughout your lifetime, but we're going to focus on those that are for the babies and the really little ones. First thing that I have to tell you is that I am a federal government employee, and I have no financial interest or no conflict with the manufacturers of any of the products of any of the vaccines in this presentation. I have no off-label use of, I will not discuss off-label use of the vaccine, so I won't discuss use of the vaccines in any way other than what the FDA and the advisory practices recommends the use for. And I won't discuss any vaccines that are not currently licensed by the FDA, which is the Food and Drug Administration. Today, what we're going to try to talk about is, first we're going to do a little bit of an overview of the immune system, sort of like Immune System 101. And then we're going to talk about the vaccines and how they work. We're going to talk a little bit about safety, and then we're going to talk about before, during, and after the immunization visit, what we can do to help make this a little bit easier on everybody, easier on the child, easier on the parents, easier on all of us. So diseases and the immune system, when germs such as a bacteria or a virus invade the body, what they generally do is they come and they start to attack and multiply. So their whole purpose is to make more bacteria, more viruses, so that then they can invade the body infection. And when enough of them multiply to a certain point, then it causes an infection. You never know how your immune system is going to react to this. All right, because one of the really great things about the immune system is that it protects us, and we don't even realize that it's protecting us. I mean, we get exposed to multiple germs throughout the day, and nobody thinks, wow, my immune system's doing a great job, because we don't even realize that we're doing it. But we've all sort of felt, I think, maybe the best way I can describe this, or maybe give you an example of this, is that we've all sort of gone to bed at night and feeling kind of punky. Maybe you got a sore throat. Maybe you kind of feel like, wow, I feel like I'm coming down with something. And then you woke up the next morning and you were fine. Your immune system was able to fight off the infection. But the same things happened, and we woke up and we were sick the next day. So there's a lot of different things that play into how well your immune system is going to work, or whether it's going to be fighting off the infection. Stress, how well you eat, exercise, what you've been exposed to, all of these things come into play. So the thing is that the immune system is a wonderful system, but you just never know how it's going to react to a virus. Sometimes you get sick, sometimes you don't, or a bacteria. So the immune system recognizes, now how the immune system fights off a germ or a virus or something that's trying to invade your system is the immune system has taken an inventory of what belongs to you. And anything, any cells or anything that come into your body that it does not recognize as part of that inventory, it determines that that's a threat to the body. So in response to that threat, the immune system produces proteins. And these proteins are called antibodies, and they are there specifically to fight the threat. Now, the thing about antibodies are virus or germ specific. All right, so for example, that's why we can catch colds multiple times, because cold viruses tend to mutate and change just enough so the immune system, the antibodies that the immune system developed for the last one are not going to work for the new one. So antibodies are designed or developed specifically for that germ. And the other thing is it takes your body some time to develop the antibodies. So contrary to popular belief, it is not the medication or the vaccines that give you the protection. What actually gives you the protection is your immune system, and the vaccines help or they initiate that immune response to develop antibodies. All right? So the vaccines help the immune system develop the antibodies, but they do not cause illness. It's sort of what a vaccine does is it allows the immune system to formulate a response and develop those antibodies at a time where the immune system is not going to be overwhelmed by the infection. All right. So if you were ever exposed to a real virus or exposed to that germ, you would have these antibodies sort of in the bank, like a checking account. Like they're there. They're ready for you. All right. And you don't have to rely on your immune system to really ramp up and fight it off quickly. All right. You have them already there waiting. So you don't have to wait for that time period to allow them to start up and make antibodies. Because of this, sometimes after getting a vaccine, you might get a fever, all right, or you might have some minor symptoms, but these are they're normal, they're kind of expected. It's your immune system's response while making the antibodies. But the thing to remember is, while the vaccines can help your body make the antibodies, the vaccines are not going to cause the illness. So let's talk a little bit about the illnesses or the vaccine-preventable diseases or the vaccines that we have to prevent certain diseases. So there is the diphtheria, tetanus, and pertussis vaccine, or DTaP vaccine. Diphtheria is caused by a bacteria that lives in the nose and the throat of infected persons. It is respiratory in transmission. That means you catch it from breathing air that's someone that has it. The thing about diphtheria is that it can form a membrane on the back of the throat, and what it does is the membrane grows and grows and grows until it blocks the airway and people suffocate. Tetanus infections. Tetanus is another disease that is protected in this vaccine. Tetanus infections occur when a bacteria enters a break in the skin. If you had my mother, you would have heard about this shot a lot, because my mother did not like us going out barefoot, my sister and myself. And so when we would head out the door in our bare feet, she would say that, you're going to go out there and you're going to step on a nail, a rusty nail, and I'm going to have to take you to the doctors and get a shot. And tetanus is what she was talking about. The bacteria usually enters through a cut or a puncture wound. It causes severe painful muscle cramps in the neck, arms, and legs and stomach. For little children or smaller children, the spasms or the muscle cramps can be so bad that it can fracture long bones in their legs. So it will actually break the bones in their legs. About 2 people out of 10 who develop tetanus die. Pertussis is caused by a bacteria. Pertussis can lead to pneumonia, seizures, encephalopathy, a brain infection, and death. This is a disease that's very serious in little ones. Sometimes people will hear you will hear people call this whooping cough, and lately in this country we've seen an increase in the number of cases of whooping cough. We are always really watchful for this, because in little ones this is something that can cause a high rate of hospitalizations and a high rate of death, especially in little ones under a year. 3 months, especially under 3 months of age. And it is but for us, for adults or older children, you know, it's not as severe a disease, and it causes probably a chronic naggy cough most often, and sometimes you can have no symptoms at all. But the thing about pertussis is that even if you don't have any symptoms, or even if it's not that severe a disease in yourself, you can still pass it on to other people. And if you pass it on to a vulnerable infant, then they're going to get really sick. Haemophilus influenza type B is the next disease I'd like to talk about. Before the vaccine, HIV was the leading cause of bacterial meningitis in children younger than 5. HIV bacteria is spread through the air by coughing, sneezing, and breathing. When it enters the bloodstream, it can cause meningitis, pneumonia, an inflammation of the throat, arthritis, and other problems. Sometimes, what I like to tell people too is that yes, we vaccinate to prevent the disease, because the diseases are awful, and nobody should have to suffer through them if they don't have to. But we also vaccinate to prevent the complications of the disease. With HIV influenza type B, deafness is one of the frequent complications associated with it. The next disease I'd like to talk about is hepatitis A. Hepatitis A is a virus that causes liver disease, which can result in fever, loss of appetite, fatigue, stomach pain, vomiting, yellow skin or yellow eyes. This disease is fecal-oral in transmission. That means that if someone goes to the bathroom or changes a child's diaper that has hepatitis A and does not wash their hands, and then they go and prepare food, that's a really good way to catch it. Children younger than about 6 years of age might not show any symptoms at all. Adults are much more likely to show symptoms. Hepatitis B is spread through contact with blood and through infected blood and other body fluids. A hepatitis B infection can cause muscle or stomach pains, diarrhea or vomiting, yellow skin or eyes, or loss of appetite and fatigue. It can lead to cancer of the liver. This is a perfect example of when I mentioned earlier that antibodies are disease specific. Even though these are both hepatitis, even though the last two that I talked about were both hepatitis diseases in that they cause an inflammation and an infection of the liver, antibodies for hepatitis A disease are not going to protect you against hepatitis B. And antibodies for hepatitis B are not going to protect you against hepatitis A. That's why it's important to remember that antibodies are disease specific. Influenza, and we're heading into influenza season. This is something that generally happens in the fall and winter in this country. It's caused by a virus. It's one of those pesky little viruses that mutates and changes just a little bit, like I mentioned earlier with the cold. So just because you've had the flu before doesn't mean that you're not going to develop the flu again. Flu is another one of these diseases that's on a spectrum. You can, for people that are that are well and have really good immune systems, it may be asymptomatic. You may not have any symptoms at all, or it can also be that disease that hits you like a Mack truck and you wish that the truck would back up and finish you off, because that's how bad you feel. It causes a fever, a sore throat, cough, headache, chills, muscle aches. This is generally a disease that comes on very quickly, like you can be fine in the morning and then you're crawling into bed in the evening where you feel really, really bad. It can lead to sinus infections, pneumonia, inflammation of the heart, and death. Generally, these type of severe ramifications associated with an influenza infection are something that we generally associate with the elderly, but that's not to say that infants and young children are not vulnerable to influenza. In fact, children under 6 months of age have as high a rate of hospitalization as elderly when it comes to influenza infections. Next vaccine is MMR vaccine, and it protects against measles, mumps, and rubella. Measles is a virus that causes a rash all over the body. It's a fever, runny nose, and a cough. It can lead to ear infections, pneumonia, encephalitis, and death. These kids are just miserable little kids. Mumps causes fever and headaches and inflammation of the salivary gland. So you think about mumps as you see that child with the really big neck and the swelling underneath their neck and their cheeks and their jaws. It can lead to meningitis, and occasionally to encephalitis or deafness or death. And then rubella is caused by the rubella virus. It causes swollen glands in the back of the neck, a slight fever, a rash on the face and neck, sometimes arthritis-like symptoms. Generally a milder disease in young children, but however the greatest danger from rubella is to unborn babies. And with when a mother is pregnant and she's exposed to rubella, especially in that first trimester, it can cause severe birth anomalies, even fetal death, congenital heart defects, deafness, cataracts, some mental issues. So it's something that you really want to avoid pregnant women being exposed to. And who's around pregnant women but young children? So once we started giving rubella vaccine to children, we saw a decrease in congenital rubella syndrome. Polio is caused by a virus, again, that enters the body through the mouth. This is a great success story when we talk about vaccines. In the 1950s, when we were at the peak of cases, it left up to 20,000 people paralyzed each year, unable to walk, sometimes even unable to breathe. That's when you would see people in those pictures with iron lungs. But thanks to polio vaccine, there's not been a case of polio in the United States in years. Pneumococcal disease, this is one of our newer vaccines. It's pneumococcal conjugate vaccine. Invasive pneumococcal disease is the most common cause of bacterial meningitis in children under 5 years of age. It's caused by a bacteria that's spread through the air. It also causes ear infections, blood infections, and can lead to death. Rotavirus causes severe gastroenteritis, severe diarrhea, and vomiting in young children. Before vaccines, rotavirus infection was responsible for more than 400,000 physician visits, more than 200,000 emergency department visits, up to 70,000 hospitalizations, and about 20 to 60 deaths a year. My oldest child was hospitalized with a rotavirus infection when she was 18 months old. We're lucky in this country that we have a healthcare system that generally these kids are seen fairly quickly, are rehydrated, and we don't have nearly as many deaths as in developing countries. In developing countries throughout the world, rotavirus is one of the leading causes of deaths in children. Varicella or chickenpox. The main system, I think a lot of us have probably experienced chickenpox in our lifetime, especially as a child. The main symptom of chickenpox is an itchy rash all over the body, but along with fever and drowsiness. It can spread from person to person through the air or contact with fluid from the rash. It's highly contagious, just like measles is highly contagious. Chickenpox is usually a mild disease, but it can cause skin infections and encephalitis. So whenever you have a break in the integrity of the skin, you're at risk for a severe skin infection. Prior to vaccine, there were approximately 100 deaths from chickenpox in this country each year. Here now you see the recommended immunization schedule for children birth through 6 years of age. This is from the CDC. This is on the CDC website, and you can print it out. I included the link at the bottom, and you can see that there's a range of vaccines that need to be given, or a number of vaccines that need to be given in this age group. Notice you can see a good example across the top is hepatitis B vaccine, and you'll see that there's a dose at birth, and then we give another dose at 1 to 2 months of age, and then another dose between 6 and 18 months is recommended for a total of 3 doses. Many vaccines require more than 1 dose to provide immunity, So it's very important that children or anyone who's being vaccinated get all their doses, because you're not protected with just 1 or 2 doses. You need all the doses in this series to be protected. Oftentimes people ask how safe are vaccines, and vaccines are a medication just like any other medications, and they can have side effects. The most common side effects that we see are generally mild, such as redness, swelling, and pain where the injection was given. These generally go away within a few days. Maybe they would require some pain-relieving medication, something from over-the-counter that the physician may prescribe. They're generally easily managed and usually aren't very much of a problem. But serious side effects can follow vaccinations, such as a severe allergic reaction. These are pretty rare, and doctors and clinic staff are trained to deal with them and prevent them. So doctors and physicians and their staff will screen for allergies and ask questions before before you give vaccines to prevent any serious side effects from occurring. Always call your doctor. Do you have me, Sarah? Okay. Okay.
It looks like we lost audio for a moment, but we have you back.
Okay, perfect. All right, so no medication is 100% safe. I'm going to close this box, Sarah. Oh, no. No, I don't want to do that. I'm just going to leave it there. No medication is 100% safe, but vaccines have an excellent safety record. Most common side effects is a sore injection site, pussiness, and a fever. To evaluate risk, you always must look at the benefits too, so it's not just a look at the risks type of thing. There is we do monitor vaccine safety on a regular basis. There's the Vaccine Adverse Event Reporting System. This is a national program. Anyone can report, not just healthcare physicians. Each year we receive about 30,000 reports about side effects or an adverse reaction or an adverse event associated with a vaccination. We monitor these reports and we look at them closely to identify if anything needs to be done based on these adverse events, whether the schedule needs to be tweaked maybe a little bit or we can give more information about them. So if you want more information about the VAERS program, there's a link at the bottom of this slide. So how can we make the immunization visit easier? The first thing to do is to bring the immunization or shot record with every appointment. Keep it, because this can prevent unnecessary doses. And then you need to be prepared to answer those questions that I mentioned earlier that the doctor is going to ask you before, like has the child had a severe reaction to the vaccine? Does the child have any allergies? Does the child have any food allergies? Does your child have any problems with his or her immune system? They're going to ask you those types of questions to prevent severe or adverse events. Then the doctors or the physician is also going to, their staff is going to give you something which we call a vaccine information statement, and I have an example of it here on the slide. Read the vaccine information statement and then always ask the healthcare provider if you have any questions or you would like more information. The vaccine information statement is going to give you a wealth of information like why get vaccinated, what is the vaccine that you're receiving, who should not get the vaccine, doses, the schedule, all of that stuff is on the vaccine information statement, so that you can ask, so that you know what your child is being given, you're knowledgeable about it, and you can ask any questions that you may have that it may bring up. During the immunization visit, which is probably one of the most challenging portions of it because no one likes to see their child get in pain, you want to help the child stay really still when the vaccines are being given. Your healthcare provider can show you how to hold the child without actually holding him or her down or frightening him. Studies have shown that breastfeeding is soothing for infants up to 12 months of age after receiving an injection, but if mom is not comfortable with that, a sweet-tasting liquid may be substituted. For toddlers and older children, you want to use age-appropriate distraction techniques like talking to them or singing, blowing bubbles, counting, reading a story, asking them questions. These are all ways to have them focus on something other than the fact that a shot's being given, and then often you can get it in and out before they even realize you've done it. And then for infants, there's I'm trying to think of a really good word for it. There's a process called the 5 S's that can be used to calm crying infants immediately after vaccines are administered, and it's really quite remarkable. And I have a video here to show you about it, how to do it. So the 5 S's are soothing, it's very soothing, and we'll talk about it when we get done. It's quite remarkable how well that worked. I mean, it's just amazing how she goes from very, very upset to totally soothed. And when we talk about the 5 S's, the 5 S's stand for sucking, which he only did 4 of them. So, I mean, he was doing really, really good. Swaddling, and you can see in that video that he swaddled her very tightly in the blanket. That helps children because they like that feeling of being tightly bound, especially the little ones, because that's the way it sort of mimics how they felt like when they were in the mother's womb. The sideline position, he put her on her side, that helps, and then the shushing. You heard him go shush, and that sort of mimics the blood flow that the baby hears when they were in the womb, and then he swang her gently back and forth, which sort of mimics, you know, what the baby felt when mom was walking around. So it helps calm them down amazingly. Using that after vaccines just empowers parents because they just think that, wow, look, I can just really comfort my baby and doesn't make them feel like they're so helpless. Later on, for 1 or 2 days after a child receives vaccine, the baby might be a little bit fussy and need a little bit of extra love and care after getting vaccinated. Serious reactions are rare, but certainly if you have any questions about how your baby's behaving or how the child is behaving, or if you have concerns about something that's going on, you can certainly call your healthcare provider and seek medical attention. Ask your healthcare provider about what type and how much non-aspirin pain reliever you can be given to help with the pain at the injection site. They do hurt. You know, while the vaccine is being absorbed and it's lying there in the muscle, it does hurt a little bit. So you want to know what kind of non-aspirin pain reliever is appropriate to be given. You do not want to give aspirin to children. And you want to exercise the limb to encourage the arm or leg that the vaccine was given in, to encourage the blood flow to the area. And cool wet washcloths on the injection site can also help with the pain. People often say that they wonder if they don't have any insurance or they don't have any money to pay for vaccines, how can they get their child vaccinated? And in this country we have a program called the Vaccines for Children program. or VFC. This helps provide vaccines to children whose parents or guardians may not be able to afford them. Eligible children include those birthed through 18 years of age and is one of the following: Medicaid eligible, they're uninsured, they're underinsured, American Indian or Alaskan Native. For more information, you can certainly talk to your child's healthcare provider, or you can look on our website at the link provided on this webpage, or you can certainly talk to your state or local health department about the VFC program and who's eligible and who's not. Another thing that people talk about is that why do I need to have my child vaccinated? Because they don't see these diseases. They don't see them as often as they used to. Certainly, parents aren't nearly as afraid of polio as my mother was for me, or they're not as afraid of diphtheria as my grandfather's mother was for him. These diseases people just don't see anymore. And when my grandfather was alive, it was very common to see the public health nurse coming out and going to visit a family and tacking up a quarantine sign because there was a contagious, serious contagious disease in the house, and they were trying to stop spread of it in the community by isolating or quarantining the family to the house. In fact, my grandfather used to run and hide underneath his bed because he thought the public health nurse took people away, because he would see the house was quarantined and then he wouldn't see the kids anymore. But it's not true when people think that the diseases are gone. We are just one plane trip away from all of them. There are many places in the world where these diseases are still common, and we have had outbreaks of disease in this country related to airplane travel, where sometimes it was from persons coming in to this country, and other times it was from U.S. citizens that went out to another country, perhaps weren't vaccinated, and then brought the diseases back with them. So even though we don't see these diseases as often as maybe my mother or my grandfather did, it's still important to make sure that we're vaccinated and protected, both ourselves and our children. So with delaying, some people choose to delay the vaccines or to put them off for a little while. And with the decision to delay vaccines, and it is a decision to delay, sometimes it feels like they're just postponing them, but delaying them is a decision. And with that decision to delay the vaccine, there's a responsibility that could save your child's life or the life of someone else. And anytime that your child's ill, anytime your child's ill, or you call 911, or you ride in an ambulance, or you visit a hospital emergency room, or you visit your doctor's office or any clinic, you must tell the staff that the child hasn't received all their recommended vaccines, because the assumption may be that the child has, and it will delay treatment for the child because maybe the child has something that a vaccine would have protected them against, but the healthcare provider does not consider it because he thinks the child's vaccinated. So it's very important that whenever visiting any healthcare provider that you let them know the child's vaccination status. Medical staff can take precautions such as isolating the child, considering the child, treating the child so the disease is not spread to others, and that the child gets prompt treatment. You want to talk to the child's doctor or nurse to be sure that the medical record's up to date. You certainly want to keep a copy of the updated record, always. Always want to keep a copy of that so that you have information to share with them, and that will prevent unneeded vaccines maybe in the future, what people don't know about. And then you want to be aware that your child can catch disease from people who don't have any symptoms. I spent a lot of time today talking about vaccines for infants and young children, but I always like to put in a reminder that adolescents and adults need vaccines too. This isn't something that stops, as you grow older. Everyone's every year, especially those who work with young children, especially infants less than 6 months of age, because infants less than 6 months of age can't receive influenza vaccine, so that the way that we're going to protect them is create a barrier or help to prevent the virus from getting close to them by being vaccinated ourselves. Adolescents need vaccines that protect them from diseases such as meningococcal disease, tetanus, diphtheria, and pertussis, and cervical cancers. Again, adults need vaccine that protects them against tetanus, diphtheria, and pertussis too, especially those that work with those infants, because we want to make sure that they're protected against whooping cough and pertussis. A lot of the information that I've shared with you tonight is in the Parent's Guide to Childhood Immunizations. This is something that you can download and look at, and I've included the link on this slide. And resources. There are a number of resources for good information about vaccines. Of course, there's CDC. There is our website, which I have on this slide. If you have any questions, you can always send us a question. I don't think too many people realize that, but you can certainly do that, and we'll answer them. And that is on the webpage cdc.gov/cdcinfo. You go on that webpage, and you will see a form that you can complete with your question, and then you'll get the answer back, usually within a couple days. And then other sources for information that are are the American Academy of Pediatrics, Every Child by Two, Families Fighting Flu, the Vaccine Education Center, associated with the Children's Hospital of Philadelphia, and then I've also included our vaccine safety website. So that's the end of my presentation. Sarah, do you want to do questions?
Yeah, that sounds great. And I'm actually going to switch it back over to our screen here in case we don't get to all of the questions tonight. I'll put my contact information up here.
Perfect.
Okay, so as I mentioned earlier, if you have any questions, please feel free to type those into the questions box. And I know that we have a few that have already come in. So I will read the questions, and JoEllen, if you could just try to answer them, then we will get through the questions that have come in.
Sure.
Great. So I guess one of the questions that has come in a couple of times is a few people are asking if they can get a copy of the slides. And if it's all right with you, we can post a copy of the slides with the video that we're posting later on next week.
Sure.
Okay, great. So we will post a copy of the slides with the recorded video. Couple of questions here. One question here says, do vaccines lead to autism?
No, I'm really glad that somebody asked that question, because I know that that's in the media a lot. You'll hear a lot about that. And there have been numerous research studies, including a review of all the research studies done by the Institute of Medicine. And what they found was that there is no link between autism and vaccines. So no, vaccines do not cause autism. Sarah, did I lose you?
Oh, sorry about that.
Okay,
Looks like I was muted. One question that came in here says, I've read that some vaccinations don't guarantee full immunity. How can you be certain your child is immune to chickenpox?
That's a really good question. Vaccines are like anything else. Nothing's 100% guaranteed. But chickenpox, for example, and a lot of the vaccines enjoy a great efficacy rate. So chickenpox vaccine with 2 doses, remember you always have to get all the doses in the series, but with 2 doses, over 95–98% of people will develop immunity to chickenpox. So that's really great, and we get that. We certainly can't guarantee that everybody gets it, but the vast majority will develop immunity.
Great. Another question that has come in is there a link for the video, or is there a website to learn the 5 S's?
There is a link to the video, and I will include that. You know what, Sarah, what I'll do is I will send over I'll send over the slides again, and I will include the link to the video. Because it is pretty amazing, isn't it? I wish I would have known about that when my kids were little. I walked the floors a lot when I probably didn't have to.
Yeah, that would be great. I know a few people have asked for a link to that video.
Yeah, I think it's a YouTube video, but I'll double check it.
Okay, great. Another question we have here is, what is in vaccines other than the actual virus or active ingredients?
So each vaccine has different things in it. There are 2 types of vaccines. There's inactivated vaccines, and then there's live attenuated vaccines. Inactivated vaccines sometimes they are the virus that has been weakened through chemicals or heat, and they become inactivated. Sometimes it's parts of the virus or parts of the bacteria that are part of the vaccine. We have live attenuated, which the vaccine actually does contain some live components, but it's been weakened to such a point or attenuated that it can't cause disease. The difference between inactivated vaccines and live attenuated vaccines is live attenuated vaccines can actually replicate. The virus can actually replicate like the infection. Remember I told you that when a bacteria or a virus comes into the body, its job is to make more of them or replicate. So a lot of times you'll notice with the live attenuated vaccines, you don't need as many doses. So for example, DTaP vaccine is a series of 4 doses in the first year of life with another dose at 5, and then a dose every 10 years after, a dose at 11 to 12 of a tetanus, diphtheria, and pertussis containing vaccine, and then a dose every 10 years after that. Whereas varicella vaccine, for example, 2 doses, and you're done. You don't need any more doses in your lifetime. Some vaccines contain something called an adjuvant that makes it work better. For a complete listing of everything that's in a vaccine, you can certainly go to something that's called the package inserts, and those are on the manufacturer's website, and in there the FDA requires them to list everything that's in the vaccine.
Okay, great. It looks like we have another question here. And many children years ago used to stay out of school for chicken pox, and now after they are given 2 doses, they come back sooner. Is that because it has changed, or is it just the same?
Can you repeat that for me, Sarah?
Of course. The question here says, many children years ago used to stay out of school for chicken pox, and now after 2 doses, they come back. It appears they come back sooner. Is that because it has changed, or is it the same?
So what happens is chicken pox has a really long incubation period. All right, so chicken pox, it takes like 14 to 21 days to develop chicken pox. It has a really long time frame where it takes for the virus to actually start replicating and growing. So because of that, a child can be exposed to chicken pox and then can be given a dose. Like if you know that the child's been exposed, you can give them a dose, the antibodies during that incubation period, and that's why they can come back sooner than before. Does that make sense?
JoEllen, are you still on the line?
Yeah, I'm here.
Okay, great. Well, it looks like we've gotten through all of the questions that have come in here. If there are any last questions, please feel free to type those into the questions box. If not, you can always contact me via email. My email address is up on the screen. And I will be out of the office tomorrow, but hopefully on Thursday, the webinar from tonight will be posted up on our YouTube channel. And at the bottom of this screen, you'll see the link for our YouTube channel, which is where we've now decided to host all of our archived webinars. So if you're looking for webinars we've done in the past, please feel free to check out those webinars through that link there. And it looks like we have no further questions coming in. So I would like to thank everyone for joining us this evening. And JoEllen, thank you so much for presenting. I hope everybody has a great rest of your evening, and we look forward to seeing you on our next webinar. Have a great night.